Hello guys, welcome once more to another episode, right? Another episode of pain during sex. In this episode, we're going to mention something about solutions, treatment. How can you solve it, right? Pain during sex. How can you solve it, right? So I hope once more you learn. I hope once more you learn something new, maybe, and it will help you to solve. Maybe if you have this kind of problem, right? So if you have not subscribed, to this channel, right, please just take 1 second. Just take 1 second and subscribe. Thank you. Right? So I hope you learn. Please remember to share the video. Please comment. Let's continue interacting in the comment section. Tell me which kind of which topic do you want us to touch in the next video, right? Yes. So having said so, treatment or solution to painful sex depends on a number of things, right? There are many ways, there are different ways to tackle this kind of issue, right? So please don't just sit down and assume that pain during sex is normal. Consult your physician, consult your healthcare provider. Be open to him or her, be very honest to him or her, and explain to him or her the kind of pain you are experiencing, what happens after every situation, right? He or she will help you or will give you the way forward, right? So, solution to pain during sex depends on a number of things. It depends on the cause, right? So, this thing is managed according to the cause, right? For example, we mentioned something about vaginal dryness. It's one of the causes of superficial pain, right? So if your pain is due to vaginal dryness, maybe due to low estrogen, right? There are different herbs, there are different gels, there are different kind of medications that contain estrogen, right? That you can be given and will help you to increase the amount of the levels of estrogen in your body, so that you can have a normal sexual response cycle, right? So if it's vaginal dryness due to low estrogen, there are different kind of gels that can be used that contain estrogen. There are different kind of tabs or medication that can be used. So consult your physician, right? He or she will give the right treatment. If it's vaginal dryness due to maybe lack of well arousal, right? Maybe this you're not well lubricated, right? So longer foreplay is encouraged. Take time during foreplay, right? The natural lubrication is the best one, right? So take time while performing foreplay, so that you can be well, your partner can be well lubricated, right? So that your partner can have the natural lubrication. Take time during foreplay, right? So there is no hurry. Sometimes you have a hurry, right? But just spend more time, right? Just spend. If you're spending maybe 2 minutes, it increases to maybe 5 minutes, maybe 10 minutes, right? So it depends on you. Depends on you and your partner, right? So my point is, increase the time you spend, right? So that you can have natural lubrication, right? That is in the part of vaginal dryness, right? So, if the cause is endometriosis, maybe if the cause is uterine fibroid, we have different kinds of hormonal treatment, right? That can help in shrinking the fibroids, that can help in shrinking the endometrial growth, right? So, you need to see your doctor, right? It's by solving maybe endometriosis, by solving maybe fibroids, you really solve a lot, right? Yes. So if the cause is infection, for example, you have urinary tract infection, like syphilis, you have gonorrhea, maybe you have this kind of urinary tract infection, you have cystitis, right? The right treatment will be to deal with this infection, right? To treat the infection of the bladder, maybe to treat the syphilis, to treat gonorrhea, right? By solving this problem, you will have solved maybe pain during sex, right? So The pain is due to vaginal dryness due to low estrogen. I've said that there are kind of medication that you can be given. If it's due to vaginal dryness, just spend more time on foreplay, right? If it's due to infection, right? The likes of syphilis, the like of gonorrhea, there are kind of medication that can help you solve this kind of infection. And you'll have solved a lot as far as your sexual life is concerned. The cause is maybe due to endometriosis, maybe due to uterine fibroids. You'll have solved a lot. They are kind of hormonal treatment, or maybe you may undergo surgery, right? And this will help you to solve a lot of problems. Again, pain during sex is not always a problem, right? Sometimes it's you're experiencing pain maybe due to the type of sexual position you're using, right? So try different sexual position, right? Try different sexual position. Maybe if this one is causing a lot of pain, try another one, try a different one, right? It will help you to solve a lot of problems. If the cause of sexual pain maybe is due to pelvic injury, right? Or maybe you have a cut, maybe during the time you're giving birth, you had some tears, you had some lacerations, right? Your healthcare provider will give the right solution, right? Yes. So you need to consult your physician. Don't assume that's normal, right? So spend more time during foreplay. If it's due to low estrogen, there are a number of medication that you can use. And again, don't just walk into pharmacy or a chemist and buy any kind of drug, right? Consult with a physician, right? Yes. If the cause is emotional, right? I've talked about maybe you had sexual abuse earlier in your life. Maybe you have sexual harassment earlier in your life. Maybe you have you are raped, right? Or you have sexual violence earlier in your life, right? And this causes emotional pain during sex, right? You really need to see a physician. You really need to see a psychiatrist, right? Or a counselor, right? He or she will help you. Just maybe by talking about it, right? Just by opening up, by sharing, right? He or she will help you solve a lot as far as your sexual health is concerned, right? So, emotional causes the likes of anxiety, the likes of depression. Maybe you are depressed, and maybe when you are depressed, it's the sexual response cycle does not work as recommended as it should be, right? So you really need to consult. You really need to open up. Don't assume, right? Don't assume that everything is right. Consult with your physician, right? Yes. So the management is not specific. The management of pain during sex is not specific. It depends on the cause. I've talked about vaginal dryness. Spend time on foreplay. This if it is due to low estrogen, right? There are a number of medications that you can be given and can help to solve it. Due to pelvic injury, right? It can be solved, right? Your physician, consult with the physician. He or she will give you the right way to go about it. If it is due to urinary tract infection, we first treat the urinary tract infection. You first treat the urinary tract infection, the likes of syphilis, the likes of gonorrhea. You have to treat them first, right? So that you can have a normal sexual response cycle. If it is due to your emotional causes, you need to see your psychiatrist, maybe your healthcare provider will give the right way to go about it, right? And again, just to finish, it may be due to sexual position, right? Try changing sex position, right? You may try position A. If you still feel pain, try position B. Maybe you may feel that you are more comfortable with position B compared to position A, right? So some pain are caused by the type of sexual position you're using, right? So try changing the sexual position. I hope you learned something. I hope it was some sort of learning. We'll continue learning more, right? So I hope you subscribe. If you have not, just take 1 second, right? Just take 1 second to subscribe, like the video, continue commenting, right? Tell us which topic you want us to cover in the next episode, right? Yes, and see you next time.